Hey there, grade nines. Welcome back to another online social lesson. Today we are looking at social programs. It's actually the start of a new chapter. It's kind of a shorter one, but then that's why I wanted to combine it in with the other two before we went on to have a chapter test. So, social programs. What are they? Well, we talked about this a lot if you can remember back to grade 6 social when we looked at the provincial government and we talked about taxes. Because social programs is when we discuss taxes and learn about taxes, we often say, oh, they pay for services that we can't always provide for ourselves. The government takes our taxes and uses it to pay for things that we can't do on our own. And lots of times that's where it falls into social programs. Like we see here on the slide, there's services provided by the government, and I like this definition. They're aimed to reduce economic inequalities. So what does that mean? Basically means places where the wealth of one person might not be the same as the wealth of another person. So we don't want people who have way more money having access to things that are basic necessities of life that then people without all that money couldn't afford on their own, right? And then you can also see, obviously, it's also to improve the well-being of citizens. And like we just said, they are funded or paid for by our taxes. So examples of them, and we're going to look at three big examples. There's a few different ones, but the three we're going to look at, the big one I'm sure you've heard a lot about, healthcare. It's kind of one of the big shining uh, jewels and things we're proud of here in Canada is our healthcare system and how we have universal healthcare for everybody. And it's funny we call it that because really a lot of countries have that, or a lot of developed countries do, except for our neighbors down south. And that's why I think lots of times we brag about it, is because of comparisons between their system, whereas a lot of developed countries in Europe and stuff do have universal health care as well. Another thing is old age pensions, so taking care of and providing funds for people after retirement that can no longer work. And basically, we're not going to look too deep into that, so explain it a bit now. Throughout our whole life, we pay into while we are working a pension plan, and then as all Canadians are paying into that plan, the people who are retiring and no longer paying into it, they are now going to receive the money back as their pension, their old age pension. So it's kind of a way that we take care of our elderly and senior citizens. And finally, income insurance, and that's basically like EI, employment insurance, disability leave. So basically, giving money to people who, for one reason or another, are unable to work at this certain amount of time to get them through, to help them through to the next time when they can get back a new job or get back on their feet. This is a food bank you can see in the picture would be another example. Lots of times food banks rely on donations from the community, but the government does often fund and give supplies to food banks as well. So we are going to compare Canada and US a little bit on how they deal with social programs, but before we do that, let's talk about values for a second. What are values? Basically, values are beliefs about what's important to you. So example, like beliefs about democracy and respect, accountability, peace. All these things are uh, concepts or ideas that we would hold at our core values, things that are important to us, important to the way that we live and our quality of life during our time. And now, obviously, your values can be influenced by lots of different things like family, schools, your religion, the things you see on TV. Another big one is experiences. And obviously, as your experiences change through life, your values are going to change. Now, why are we talking about values? It's not health. Because the way that a country spends its money and how it treats its citizens can definitely tell you where its values are. The way their economy works can show you where their values are, and I think social services or social programs a lot of the time can definitely show you the values of a country, whether they value economy over maybe the security of individuals and all that different stuff. And you're going to see definitely a difference in values when we compare Canada versus the United States, as we're going to do next. So what we're going to do is we're going to take a deep dive in healthcare. That's the big one that's different between Canada and the United States. And I apologize right now because when I look at this American flag is higher than that Canadian flag, and it is bothering me right off the get-go. So hopefully you can ignore that. Anyways, when we look at let's talk quickly about old age pension. Canada has the Old Age Security Act, which is part of our federal legislation, which definitely takes care of our elderly once you turn 65, you're eligible for old age pension. The United States does also have some things in their Social Security Act, but they definitely do rely a lot more on personal savings. And because you're not paying as much in taxes, they expect you to save more money into your retirement fund. So they definitely don't help their senior citizens as much as Canada does. And then income insurance is very similar between the two countries, helping EI and people get between jobs. But healthcare is very different. So let's take a look at that. Canada first is publicly funded healthcare, public healthcare. What does that mean? Well, we talked about the things being publicly owned when we looked at market versus mixed economy. And publicly owned means that the government funds it, right? The government owns it, government controls it. So public health care means that it's being paid for by the taxes. There's a bunch of different, uh, what's the word I'm looking for, categories or like requirements. Principles, that's the word. Principles for Canadian healthcare that are laid out, and we're going to talk about those on the next thing. But the general idea is to understand that everybody pays taxes for it, and everybody has access to healthcare at any time. In the United States, it's very different. It's private healthcare, paid for by the individuals. So if you get sick and you go into the doctor, you have to pay for the doctor's time. You have to pay for surgeries, incredibly expensive in the United States. Any anesthesia, which means like putting you to sleep or numbing things on your arm so they can put stitches and stuff, all that you need to pay for. Some Americans, and very important, you notice that I put the word some, because people will tell you many Americans, and that's just not true. Some Americans purchase health insurance, which is just like buying car insurance. If your car crashes, your insurance company will help you pay for the damages. Health insurance, if you get sick, the health insurance company will cover your costs. Health insurance is very expensive, and many Americans cannot afford health insurance. So um, there's a big argument about healthcare in the United States and whether healthcare should be a basic human right and be public as well, versus continuing to have it private. And as you remember talking about the market economy, the idea of having things private and able to make money is a huge value of the United States economy. It's something that they deeply value. Um, but what makes you think, how might decisions on social programs, when we look at this example, connect to the principles of mixed and market economies? I kind of gave you a little bit of a hint there before, but you definitely can see those values of these different economies come forth when you look at something like social programs. So these were those principles I was talking about from the Canadian Health Act. And basically, they say that our healthcare will be publicly administered, and that means it's run by the government for no profit. They don't make money off of it. It's something that all Canadians have access to, and that's what universal means: available to everybody. Portable. That means it's available everywhere in Canada. No matter where you make your home in the country of Canada, you have to have healthcare available to you. Accessible. That means that it's available within reasonable time and distance. So uh, they can't say, well, I mean, yeah, you have healthcare available to you. It's a plane flight away or it's a 4-hour drive, but you have healthcare available to you. You have to have a hospital or somewhere within a reasonable distance. And then comprehensive. Comprehensive basically is a big fancy word to mean that care is provided by hospitals. So if you went in for stitches or a flu, physicians, doctors, and also surgeons. So surgeries are included in that Healthcare Act, but not things like dental care or vision care. So going to the dentist or going to the eye doctor are not part of our Healthcare Act. So for today, that's it. What I want you to do is I'm going to give you 4 article clippings from different newspapers. 2 of them are in defense of healthcare as a publicly funded um, commodity, so things that like we have in Canada, and 2 will be in support of privately owned healthcare, like they have in the United States. And what I want you to do is I want you to read those 4 articles And I want you to identify an issue that you could see coming up with our system in Canada. So, a potential problem, because it's not perfect, right? There's definitely pros and cons to both systems. You might prefer one over the other, but that doesn't make it perfect. So, reading those four articles, I'd like you to identify a problem that we have with our healthcare system, and then what I'm going to get you to do is just respond to it. I want you to say why you think it's a problem, and I want you to give a couple suggestions on how we might improve that problem. And I'm going to read all of your ideas, and I'm going to give you a bit of feedback because I think it's a really interesting topic to talk about and think about. Other than that, guys, have a fantastic weekend, and we will talk on Monday.